February is Heart Health Month, very important. And joining us now is Dr. Tatiana Saul with Sharp Memorial Hospital to talk about some hidden signs of heart disease. Good morning. Thank you for joining us.
Thank you for having me.
Of course. So first off, let's start with the basics for folks that maybe, aren't familiar. What is heart disease and who does it impact?
Yeah, very good question. I think I'm going to answer the second one first. So it can impact anybody. But now to go back to your first question. So it's something going on that's abnormal with the heart, whether it's an electrical component, a structural component, or a coronary artery disease component.
Wow, okay, so lots of different variations there. What are some common causes of heart disease, and what is the driving force behind somebody having one?
Yeah, that's a very good question because, most certainly heart disease is impacted by so many factors. And, there are some people that have a genetic predisposition to it, most certainly. But there's a lot of components of heart disease that are things that we do every day. So, lack of physical activity, smoking, and then things that we go to get checked up at the doctor for, hypertension, high cholesterol, and diabetes.
There's so much. Wow. And speaking of, and for people, the older we get to, things to look out for, but sometimes our body, is giving us signs. What are some of those common symptoms to look out for?
I think it's important to acknowledge that heart disease comes on sometimes very slowly. And so it's sometimes not a very profound symptom, but it's something that you notice may be different from last year or 2 years ago. The first sign is really exertional things. Like if last year you could take a flight of stairs and feel well, and this year you feel funny, maybe more fatigue on exertion, shortness of breath, and especially chest discomfort is very important to acknowledge.
And does that vary from men and women? Is it a little bit, how would you help a man or a woman patient decipher?
Very good point. And I think that really comes down to when people have heart attacks, that we always hear that women and men can have varying signs.
Right.
And to kind of speak to that a little bit. So most commonly people experience some type of chest discomfort, whether they describe it as pressure or tightness, but women tend to present more atypical than men. Sometimes they complain of pain between the shoulder blades, nothing in the chest itself. Sometimes just shortness of breath, nausea or vomiting.
Wow, that's so interesting. So, and you talked about some of the common, quickly if you can, maybe go over some of the symptoms that people might be ignoring.
Yeah. I kind of mentioned the slow onset of symptoms, but another one is kind of things that happen even at rest. So, we were talking about atrial fibrillation earlier. So things like if you feel kind of palpitations, especially things that are prolonged or not getting better, swelling of the lower extremities most certainly can be a sign of heart disease as well.
And as far as seeking treatment, when is a time, maybe it's crossed your mind, when should someone visit their doctor?
Yeah. I think people know their bodies the best, right? And if you most certainly feel like something is wrong or abnormal, definitely a good time to go. But especially if things are getting worse, if they're prolonged in nature or new. Wow. It's a good time to just discuss if it could be a sign of something concerning.
Right. And as far as how we can reduce our risk, I know diet's a big factor. I know that's something I'm trying to always incorporate. Healthier choices.
I think it's a very hard thing to do, right? Because it's something you have to incorporate in your everyday life. And so most certainly, right, heart-healthy diet is a big part of this, but exercise too. And I'm going to give a number. It's 150 minutes of moderate intensity exercise a week.
Okay.
Reduces cardiovascular disease.
Write it down, everybody. Wow, important tips. Anything else that people should do as far as treatment?
I think a big part of it is lifestyle, and we talked about that. And, I didn't, of course, no smoking is really important, and reducing the amount of alcohol that you take, but following up with your doctor, because some of the hidden things are things we don't feel. You don't feel hypertension, you don't feel diabetes, but getting regular checkup for these things to make sure that they're within normal limits or well controlled, to kind of really truly reduce your cardiovascular risk.
Right, such good reminders, especially with our busy day to day. Sometimes a doctor's appointment and you're like, wait a minute, it's been a little too long since I visited. So always a good reminder. Thank you so much for joining us.
Thank you so much.
Dr. Tatiana Saul, thank you so much.
Thank you.